Bismillahirrahmanirrahim. Rabbi zidni ilma. Quote of the day: don't let anyone ever dull your sparkle. Assalamu alaikum everyone. My name is Dr. Sadia Rafiq, and under the supervision of Professor Dr. Sara Afzal, today my topic of presentation is influenza. Learning outlines includes introduction, epidemiological determinants, clinical features, level of prevention, recent updates, and multiple choice questions. Learning outcome. At the end of this presentation, participants would be able to describe influenza, its epidemiological triad, chain of transmission, clinical features, and level of prevention. Annual global incidence of influenza infection is up to 30% of all children and up to 10% of all adults. If we see the hierarchy about the burden of flu disease, it leads to 9 lakh to 41 lakh illnesses, 1,40,000 to 7 lakh hospitalization, and 12,000 to 50,000 deaths. And if you can see, this is a transmission of flu, and this is a burden of the disease, which includes the moderate to severe hospitalization and the deaths. And at the base, these are the inapparent cases. Talking about the flu pandemics, Spanish flu pandemic, which was the worst pandemic in the history, which led to 15 million deaths and was in 1918. It was by H1N1 and by the avian origin, Then in 1957, this was Asian flu pandemic, 1 million deaths. 1968, Hong Kong pandemic, which was 1 million deaths. 2002, SARS epidemic, which led to 774 deaths. Then H1N1 pandemic, which led to 28,000 deaths in 2009. And in 2012, MERS pandemic, 858 deaths. And in 2019, COVID-19 pandemic, which led to 67 deaths till 6th April 2020, and is still going on. So in 1918, Spanish flu was the deadliest pandemic. As you can see, the churches, schools, and shows were closed. Rigid quarantine rules were established, and you can see the patients' isolation and the health staff. Introduction. Influenza, commonly known as the flu, is an infectious disease caused by influenza virus. Symptoms range from mild to severe and often include fever, running nose, sore throat, muscle pain, headache, coughing, and fatigue. Talking about the epidemiological triad, which revolves around the host, agent, and environment. Starting with agent. It is a structure of the virus. Influenza, the flu, is common infectious disease. Family is Orthomyxoviridae. It has 3 types: type A, type B, and type C. You can see in type A and type B, there are 8 RNA segments. And in type C, there are 7 RNA segments. Basic difference. So orthomyxoviruses, RNA enveloped virions, which is virus particles that measures between 80 to 120 nanometer in diameter. The nucleocapsid, which consists of protein shell of capsid and contains the viral nucleic acid, has helical symmetry. So it is the I'm talking about. Types of the influenza, which are very important. Here's 4 types: influenza A, B, C, and D. Influenza A is the most contagious, most virulent type of the influenza. It infects a wide range of animals, including birds. Influenza B mainly infects humans. Influenza C infects humans and pigs, but more rare than type A and B. And influenza D infects cattle. Now we are talking about the A subtypes, which is influenza A subtype, which is avian, also known as bird flu. It can infect human. It was basically started again in the China in 1860. H5N1 is a different strains. Then the swine flu, which can infect humans and spreads to pigs, H1N1, H3N2. And the most common humans are the H1N1, H3N2 strains. Then HPAI versus LPA. What is this? These are the subtypes, can be classified as high path or low path based on the ability of the specific virus strain to kill the chicken in the lab setting, because it is basically the virulence of the virus. Human seasonal influenza virus, it has 2 types, influenza A and influenza B. These types A and B cause most human illness in the flu season. So the most important subtypes of this are H1N1 and H3N2, and these are the further subtypes of these influenzas. Host, it affects all ages, both genders are equally affected. Environment is throughout the year in tropical country, mostly in winter seasons. Talking about the social determinants of the influenza are the climate change, vaccination, healthcare access, unknown factors, workplace policies, school policies, neighborhood, individual. These all lead to affect the influenza spread and its epidemics. Chain of transmission includes the infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Reservoir, animals and birds, source of infection are cases and subclinical cases. Period of infectivity is 1 to 2 days before and after the onset of symptoms. Moving towards the mode of transmission, this is an infected person and this is a susceptible host. So you can see it is basically airborne. Evaporation, droplet nuclei go in by the inhalation, it affects the person. Second is by the droplets, travel directly to the mucosal surface by coughing or sneezing, just goes directly into the mucosa. Third is deposition by the contact on the contaminated surface by person touches and got infected. So these are the different modes. Influenza symptoms includes a fever, muscle ache, chills, rhinitis, cough, weakness, diarrhea, vomiting, fainting, sore throat, and headache. So if we see the symptoms, system-wise and the complications, symptoms are neurological, respiratory, gastrointestinal, mucoskeletal. Up to 75% have no symptoms. And leading to the complication, neurological, cardiac, respiratory, pregnancy, and musculoskeletal. And these complications are unfortunately most common in children. Levels of prevention. First is primary prevention, which is health promotion. Remember the 3 W's to protect yourselves and others this season, which is wash your hands, wear your mask, wash your distance, and get your flu shot. This is influenza vaccine. It is 1 ml. Specific protection, immunization. Influenza flu vaccines, often called flu shots, are vaccines that protect against the 4 influenza viruses. Most flu vaccines are flu shots given with a needle, usually in the arm, but there also is called a nasal spray flu vaccine. The CDC recommends annual influenza vaccination for everyone aged 6 months or older. Vaccination is especially important for people at high risk of influenza complications. So who are the one who could have more complications? Children and infants, adults aged 65 years and older, pregnant women, and women up to 2 weeks postpartum. It means 2 weeks after delivery. Different types of flu vaccines. Flu vaccines cause antibodies to develop in the body about 2 weeks after vaccination. These antibodies provide protection against infection with the virus that are used to make vaccines. The seasonal flu vaccines protect against the influenza virus that is suggests may be the most common during the upcoming season. These are the different types, which are flu shots. Flu shots are vaccines given with a needle, usually in the arm. With the quadrivalent flu vaccine, it protects against 4 different flu viruses. Then the high dose flu vaccine. The high dose vaccine contains 4 times the amount of antigen. It is a part of the vaccine that helps your body to build protection against flu viruses as a regular flu shot and is licensed specifically for people 65 years and older. Then the cell-based flu vaccine. These are grown in cultured cells of mammalian origin instead of in hen's egg. Then the nasal spray flu vaccine, it is the only type of vaccine which is live attenuated influenza vaccine. It is given in the form of a nasal spray. Then the flu vaccination by jet injectors. Flu vaccination by jet is approved for use in people 18 through 64 years old. Then the adjuvanted vaccines, this is made with an ingredient added to the vaccine that helps create a stronger immune response and is licensed specifically for people 65 years and older. Then the recombinant flu vaccine are produced using a method that does not require an egg-grown vaccine virus. These are for those people who are allergic to egg. So if we see the different vaccines and the description, first is trivalent vaccine. It covers 3 strains and it recommended for adults 65 years and older. Then the quadrivalent, which has 4 strains, anyone 6 months and older. Then adjuvant high dose, which is immune boosting, usually adults 65 years and older. Then the recombinant. It is produced without the use of the influenza virus or chicken eggs. 18 years and older. Live attenuated for nasal inhalation, it is for between 2 years to 49 years. Age group recommended vaccine, its type, and the strain cover recommendations. First group is child age 6 months to 2 years. Egg grown, quadrivalent vaccine, it's not live, it covers 4 strain. and it is given for those where live attenuated is not suitable. Then children aged 2 to 17 years, live attenuated and QIV can be given. It is only the form which is live. It also covers 4-strain nasal vaccine, how to reduce spread of flu virus in children. Then adult age 18 to 64 years, quadrivalent vaccine, which includes a recombinant, cell-based or egg-based. It is not live. It also covers 4 strains. Then the adult age 65 and over, quadrivalent influenza adjuvant or recombinant. It is also not live. It also covers 4 strain. It is adjuvant is vaccine is ready to make more effective in older people. Get the 411 flu vaccine. CDC recommends annual flu vaccine for everyone 6 months and older. High dose vaccine, age 65 or older. Standard vaccine, infants more than 6 months, healthy adults, pregnant women. Egg-free vaccine for the egg allergic people. Needle-free vaccine, age 80 to 64. Then the nasal spray for non-pregnant, age 2 to 49 on the recommendation of your physician. US authority discourages use of nasal influenza vaccine because it has less efficacy than the injection, so it is not recommended. Again, nasal flu vaccine is not working and should not be used in this season. These were the 2 articles on it. And reason for getting a yearly flu vaccine. The first reason is that because flu viruses are constantly changing, flu vaccines may be updated from one season to the next to protect against the most recent and most commonly circulating viruses. The second reason that annual vaccination is recommended is that a person's immune protection from vaccination declines over time, and annual vaccination is needed for optimal protection. Contraindications of the vaccination includes a severe allergy to chicken eggs, severe reaction to previous vaccination, develop GBS within 6 weeks after getting vaccination, and children less than 6 months of age. How to avoid a twindemic. Do your part to avoid a flu epidemic on the top of COVID-19 pandemic. Everyone over 6 months need a flu shot every year. So keep your family and community healthy by getting vaccinated today. This is the diagram showing the global seasonal influenza vaccine sales by category 2018 versus 2028, and you can see, and these are the different types of the vaccine. In 2018, the total amount was 4.56 billion, and in 2028, it is anticipated sales is 6.53 billion. So flu prevention tips. Flu risk reduced 60% by vaccine. Influenza is the only respiratory virus preventable by vaccination. Keep your hands clean, cover your mouth and nose, don't touch your face, smiling because laughter can immune your immune system. Eat healthy, exercise, and stay home until your fever is gone for 24 hours without using fever-reducing medicines. Influenza prevention and treatment involves the use of air pollution masks, exercise regularly, vaccination, prevention, eat fresh food, wash hands, enough rest, avoid the rain, avoid close the patient, and the treatment involves to see your doctor and take medications. 3 steps to stop influenza. Number 1, prevent. It is never too late to get a flu shot. Take a time to get a flu vaccine. Avoid close contact with the sick people. 2, protect. Wash your hands or use an alcohol-based sanitizer. Cover your cough and sneeze. Clean and disinfect surfaces. And 3 is the take care. Stay home when you are sick and wait to return until 24 hours after fever is gone. If your symptom worsen, contact your healthcare provider. National Influenza Vaccination Week, first full week in December. So I'm the flu, and each year I'll kill thousands. I want it going viral. So get vaccinated. Influenza vaccine market size growth analysis by 23. Global influenza market is projected to reach 10 million by 2030. It is a Venn diagram showing similarities and dissimilarities between flu and COVID-19. If we talk about symptoms, begin 1 to 4 days after exposure. Symptoms begin 1 to 14 days after exposure. The cause is influenza virus. There are many strains. Cause is SARS-CoV-2 virus. Complication less likely to occur because of immunity buildup over time. Complications, severe respiratory complications may come on extremely quickly. Prevention is flu shot and prevention is self-isolation. And the similarities are transmitted by respiratory droplets from an infected person, cause fever, cough, and fatigue. Secondary prevention. The signs and symptoms of influenza can vary by age, immune status, and the presence of underlying medication condition. Uncomplicated influenza can have signs and symptoms, fever, muscle ache, headache, lack of energy, dry cough, sore throat, nasal congestion, and possibly running nose. Diagnosing flu by CDC. A number of tests are available to detect flu viruses in respiratory specimen. The most common are called rapid influenza diagnostic tests, RIDITs. It works by detecting the part of the virus which is antigen that stimulate an immune response. These tests can provide results within approximately 10 to 15 minutes, but may not be as accurate as other flu tests. Therefore, you could still have flu even though your rapid test result is negative. Other flu tests called rapid molecular assays detect genetic material of the flu virus. Rapid molecular assays produce results in 10 to 15 to 20 minutes and are more accurate than readings. Treatment. Usually person will need nothing more than rest and plenty of fluids to treat the flu. But if a severe infections or are at high risk of complications, doctor may prescribe an antiviral drugs to treat the flu. Antiviral drugs can help treat flu illness. Antiviral drugs are different from antibiotics. Flu antivirals are prescription medicines, which could be pills, liquids, intravenous solutions, or an inhaled powder, and are not available over the counter. It is a very important point regarding antiviral drugs. They are not available over the counter. Antiviral drugs can make illness milder and shorter the time of sickness. Flu treatment. There are 4 FDA-approved antiviral drugs recommended by CDC to treat flu this season. The basic names are, generic names are oseltamivir phosphate, then the zanamivir, piramivir, biloxavir, marboxil. Their different trade names are also given. Use of antiviral treatment for influenza. First, if the population is healthy individual with uncomplicated clinical presentation, there is no need for the treatment. Then the high-risk individuals with uncomplicated clinical presentations, then they can be treated with the oseltamivir or zanamivir as soon as possible. And high risk or healthy patient with severe or progressive clinical presentation, treat with oseltamivir as soon as possible. Use zanamivir if oseltamivir unavailable for patient with immunosuppression. Use higher dose in a longer duration of treatment. So we can sum up influenza as the causes are influenza virus C, A, and B, and the most virulent is type A. It has different symptom, fever, I have discussed it, and the prevention is get your flu shots. Recent updates. GIRS, Global Influenza Surveillance and Response System. National Influenza Center collect virus specimens in their country and perform preliminary analysis. They shipped representative clinical specimen and isolated viruses to WHO. CCs for advanced antigenic and genetic analysis. The result from the basis from WHO recommendations on the composition of the influenza vaccine each year, as well as relevant risk assessment activities of WHOs. NICs are a national institute designed designated by National Ministries of Health and recognized by WHO. They form the backbone of the WHO's Global Influenza Surveillance and Response System. You can see these small triangles are the National Influenza Centers. Red one is a WHO collaborating center for reference and research on influenza. Then Center for Surveillance, Epidemic Control of Influenza. Then the WHO Center for Studies of Ecology of Influenza in Animals. Then the Essential Regulatory Laboratories and Reference Laboratory. You can see in this map. WHO collaborating centers for reference and research on influenza. The WHO Collaborating Center for Reference Research on Influenza are the Victorian Infectious Disease Reference Laboratory, VIDRL, in Melbourne is a part of World Health Organization, GISRS. The network was established in 1952 to monitor the frequent changes in influenza virus with the aim of reducing the impact of influenza through the use of vaccine containing currently circulating strains. Together with the WHO collaborating centers in Atlanta, Beijing, London, and Tokyo, we are responsible for analyzing influenza virus currently circulating in human population in different countries around the world. The information is used by WHO to make recommendations on appropriate viruses to be included in annual season influenza vaccines from the northern and southern hemispheres. We also undertake research, training, and regional capacity building activities related to influenza. This is also a document of WHO, Influenza Sentinel Surveillance. It is a course, basically, training course. And learning objective is to provide a public health background on influenza, introduce a major step and concept involving conducting public health surveillance, and discuss the rationale and objectives of conducting sentinel surveys for influenza. Global Influenza Strategy through 2019 to 2030. The Global Influenza Strategy for 2019 to 30 provide a framework for WHO, countries and partners to approach influenza holistically through tailored national programs, from surveillance to disease prevention and control, with the goal of strengthening seasonal prevention and control and preparedness for future pandemics. To achieve this, the strategy places a large focus on the following, which is the development of better global tools such as vaccines, antiviral treatments that would benefit all countries and instill public confidence and uptake. Stronger country capacities that are integrated within national health security planning and universal health coverage efforts. Influenza prevention, control, and preparedness are functional building blocks for capacity building and can enhance core capacities across the health spectrum. A country-level approach and country ownership are vital for ensuring the sustainability of national influenza program, which serve as an investment for greater health system strengthening and pandemic preparedness. With its focus on country impact, the strategy is aligned with the goals of WHO's 13th General Program of Work for achieving universal health coverage, addressing health emergency and promoting healthy population. The strategy built on the success of global influenza surveillance and response system and pandemic influenza preparedness framework as it integrates broader goal for prevention, control, and preparedness for all countries. Next is antigenic test, COVID plus influenza, 1 sample and 3 tests. In this, for rapid detection of SARS-CoV-2 and influenza type A and B virus antigens in 15 minutes in nasopharyngeal specimen. So, these are what are the advantages of this. It is 3 strains can be identified. Results come in within 15 minutes. It is detection without any specific equipment. It is simple 3 to 4 steps. And it is immediate result allow an earlier start to made on tracing and isolating contact cases. So 2022. Influenza season, stop influenza. 22 influenza vaccination includes influenza vaccination is particularly important this year with the easing of international and domestic public health measures arising from COVID-19 global pandemic. A resurgence of influenza is expected in 2022. Annual influenza vaccination is recommended for all people aged 6 months and over unless contraindicated. The National Immunization Programs NIP funds influenza vaccine for people most at risk. 2022 influenza vaccine from the NIP will become available from 4th April 2022, subject to local supply arrangement in states and territories. The public are encouraged to start to book their appointment from mid-April to ensure the best protection at the peak of the season, which is usually between June and September. Influenza and COVID-19 vaccination. ATAGI, which is Australian company, firm has advised that influenza vaccines can be co-administered on the same day with the COVID-19 vaccine. Influenza vaccine, free flu vaccine under the National Immunization Program are available from April 22, subject to local supply arrangements. For adults aged 65 years and over, adjuvant influenza vaccines are recommended over standard influenza vaccine. The adjuvant vaccine flood quad is funded under the NIP for this age cohort. Influenza vaccine timings. The highest level of protection occurs in the first 3 to 4 months following vaccination. Annual vaccination should ideally occur before the onset of each influenza season. Eligibility for influenza vaccine under the NIP remains unchanged for 2020. That includes children from 6 months to less than 5 years of age, adults age 65 and over, pregnant women during any stage of pregnancy, people age 6 months and over with medical condition will increase the risk of complications. So help stop the flu in 2022. Now moving towards the MCQs. Influenza is a serious global health threat that impacts all countries every year. Which of the following influenza virus serotype that causes most of the epidemics? Type A, type B, type C, type D. A. Yes, type A is correct. It is most contagious one, and it is cause of the most of the epidemics. Influenza is a viral infection that attacks the respiratory system. Which of the following is not the common symptom of flu caused by influenza virus in adults? Fever, cough, rashes, headache, sore throat. C. Yes, the correct answer is C, rashes. Orthomyxoviridae is a family of RNA viruses and cause influenza in birds and mammals. The properties of orthomyxoviridae includes all of the following statements except the virus consists of single-strand RNA. The outer enveloper virus is made of lipid bilayer. The size of the virus is larger than 150 nm. The hemagglutinin and neuraminidase of the influenza virus helps it to attach the host cells.
Delta.
No, the
A. A.
C. As the in the picture you have seen is a single-stranded RNA. The correct is C. The size of the virus is between 80 to 120 nanometers. I have mentioned in my slide as well. So it is not larger than 150 nms. So this is a wrong statement. In what year did the influenza pandemic was the most severe pandemic in history, which killed millions of people? It was caused by H1N1 virus with genes of avian origin. 1945, 19
Delta.
Delta 1980, which is called the Spanish flu. H5N1 is a highly pathogenic and contagious causative agent of H5N1 flu. Which of the following is the source of H5N1 infections in humans? Birds, pigs, parrots, cattle.
A.
Yes, A is the correct answer. Birds because it's avian. Immunity to a disease is achieved when there are antibodies to that disease in a person's system. Which of the following virus can give long-like immunity to the disease after prior infection or immunization? Influenza A virus, B virus, C virus, and measles virus.
Delta.
Delta. This MCQ was just to make reassure that there is no lifelong immunity of the influenza virus. That's why I put this MCQ. All our yearly vaccination is required in case of influenza virus. There is no lifelong immunity. The most common route of the transmission of the influenza virus is airborne droplets. Which of the following type of virus is considered highly contagious and is known to spread rapidly from person to person? Influenza A, rhinovirus, influenza B, HIV, herpes.
A.
Correct. A is the correct answer. Which of the following statement reflects the pathogenesis of influenza virus? Viremia is common. Pneumonia is not associated with secondary bacterial infection. The virus enters the host in airborne droplets. Viral infection does not kill cells in the respiratory tract. The virus frequently establishes persistent infection in the lung. Just focus.
Delta.
Just focus on the statement. C is the correct answer because the virus enters in the host is the airborne droplets. It reflects the pathogenesis by its portal of entry. Influenza virus is spread when people with flu cough, sneeze, or talk and sending droplets with virus into the air. Which of the following is not correct about the preventive measures of the influenza virus? Wash hands more often helps. A sick person with flu should stay isolated at least for 24 hours. Over the counter, antiviral drugs are available for the influenza virus, and live attenuated and inactivities both are used for vaccination.
C.
Yes, C is the correct answer. Antiviral drugs are not available over the counter. A 16 years old girl came to the clinic with a sore throat, fever, and headache. The symptoms demonstrate seasonal influenza flu. Which of the following primary samples or specimens is collected for the laboratory diagnosis of the influenza virus? Blood, sputum, urine, nasopharyngeal washings, or stool?
Delta.
Yes, nasopharyngeal washings. This is my key, and thank you so much.
Thank you very much, Dr. Sadia. Very nice presentation. As we know that influenza is very important because it has caused epidemics and pandemics, and the timeline that you have presented was really wonderful. So all the attempts that has been done till date to control influenza epidemics and pandemics have so far met with little success, and we have been failed miserably, while the prospects to achieve the control, they always remain poor. So the good ventilation, avoidance of crowded places, and encouraging sufferers to cover their faces with masks and handkerchiefs while we are staying at homes, they are some of the precautions. And WHO has recommended that each year new vaccines has to be developed, and for this the continuous surveillance has to be done so that we can predict what type of the epidemic can be prevented by vaccination. For the effective vaccine, we all know that at least for before the epidemic, 2 weeks before the epidemic, and at least 2 months before the seasonal season, the influenza vaccine has to be given. So it is the recommendation that every year the strains, new strains must be included in the vaccine. and that is why each year we have again a new vaccine for influenza. My question or my query in today's presentation is about the availability of these vaccines. Dr. Sada, you have presented that these vaccines are available free of cost through National Immunization Program (NIP). I think you are not talking about Pakistan.
Yes,
Am I
ma'am.
right?
Yes, ma'am. Yes, you are absolutely right.
Okay. Right, because in Pakistan still one has to purchase the vaccine to get vaccination against influenza. And what was that country where it is offered free that you have presented in
Australia.
your slides?
Australia.
In Australia, right? So this is one of very important thing that even during COVID, the flu vaccines have been advised because we were talking about the twin demic. We were little bit of we were in fear that when two pandemics would have joined like a flu vaccine, like influenza and COVID, it may cause twin demic. However, we have offered even the COVID vaccine totally free of cost to the citizens of Pakistan, but not the influenza vaccine. So this is the query and it is well addressed. Thank you very much.
Thank you
We
so much.
can stop here. Okay, thank you.
Thank you.
Allah Hafiz.
Allah Hafiz.